Assalamu alaikum, Bismillah Rahman Rahim. Inshallah, we will present coccidiosis in poultry. What is avian coccidiosis? What is the etiology and the life cycle of the parasite? What are the clinical signs that we can see on the chicken, and the diagnosis and the control of it? So, what is avian coccidiosis? Coccidiosis is caused by a protozoa of the phylum Apicomplexia, family Eimeridae. Most species affecting poultry belong to the genus Eimeria and infect various intestinal sites. The disease course is rapid, ranging from 4 to 7 days, and is characterized by parasite replication in host cell with extensive damage to intestinal mucosa. Coccidia in poultry are generally host-specific, and the different species infect specific portions of the intestine. So, what is the cause of avian coccidiosis? What is the etiology of it? As a clinical disease, it occurs only after ingestion of relatively large number of sporulated oocysts, and we must insist that it must be a sporulated oocyst by a susceptible bird or a susceptible host, example, those that are immunosuppressed or with concurrent disease. Both clinically infected and recovered birds shed oocysts in feces, which contaminate feed, dust, water, litter, and soil. Oocysts may be transmitted via equipment and personnel, as well as the presence of insects as flies and rodents. Fresh oocysts are not infected, which is very important, until they are sporulated. So the infective stage here is sporulated oocysts. Under optimal condition, 21 to 32 Celsius, with adequate moisture and oxygen, this requires from 1 to 2 days. So the pre-patent period is 4 to 7 days, and its sporulated oocysts may survive for long periods depending on environmental factors. Oocysts are resistant to some disinfectants commonly used around livestock, but are killed by freezing or high environmental temperatures. After that, we are gonna know a brief show of how Eimeria proliferate inside of the host, which is poultry in our case. In this life cycle of Eimeria, first, the cycle period or the pre-patent period is from 4 to 6 days, which is considered a fast or short cycle. The mode of transmission is oral fecal by ingestion of a sporulated oocyst. Infective stage, sporulated oocyst in feces. Type of life cycle is direct, involving sexual and asexual stage. Myriad species that affect poultry are different types as Eimeria tenella, Eimeria nicatrix, and Eimeria maxima, Eimeria maritis. Going next to demonstrating on the life cycle of Eimeria. First, we start by the infected bird or infected chicken, as we talk about coccidiosis in poultry. The infected chicken eject a oocyst to its environment, its litter or shed. This oocyst, which is consisted of zygote and oocyst wall, goes through a sporulation stage. Sporulation stage needs a suitable environment, a suitable temperature and humidity and oxygen in order for sporulation stage to happen. So we have here a 4 sporocyst having 8 sporozoids inside of the sporulated oocyst. The sporulated oocyst then is consumed or taken by the oral route of the chick from the litter or the shed. The sporozoids are labeled as number 4 are released from the oocyst and go to the gizzard or the proventriculus. Each sporulated oocyst have 8 sporozoites. After shedding of the oocyst and in the proventriculus, sporozoites go to the intestinal mucosa, start in the asexual stage, where the sporozoite change to trophozoite, and then trophozoite change to a schizont by maturation, and then schizont change into merozoites, where merozoites infect another intestinal cell. Here merozoites go to the sexual reproduction stage. So we have 3 stages: sporulation, and then asexual reproduction, then sexual reproduction. The merozoites make the micro and macro gamete formation, and both fertilize each other, making another new oocyst will be infective, which will be in the environment, making another oocyst, which will be ejected by the chicken to the litter, and the cycle repeats. So what is the clinical signs of coccidiosis? Coccidia invades the intestinal mucosa and induce a certain degree of epithelial cell damage and inflammation. An oocyst cause marked histological alteration of host intestinal epithelial cell. So it causes a marked histological alteration of host intestinal epithelial cell over a short time period, including distortion, rupture as is, separation from adjacent cell, sloughing, infected birds present with a ruffled feather, and signs of depression and drowsiness. Additionally, feed and water consumption are decreased, and feces may be watery, whitish, and occasionally blood, as in figure D. This results in dehydration, impaired weight gain, and in absence of treatment, it will cause death. Additionally, there is a problem of malabsorption due to reduced brush border enzyme activity and disruption of intestinal integrity that caused by eumeria. So how can we diagnose coccidiosis? Coccidiosis is mainly diagnosed by histopathological examination of samples collected at necropsy. And lastly, how to control coccidiosis. First, we use an anti-coccidial compounds in feeder water as ambrolium or folic acid antagonists. Vaccination, or using a combination of both anti-coccidial and vaccination to prevent the clinical signs. Once clinical signs appear, use of antibiotic and supportive care as advisable to minimize dehydration and secondary bacterial infection. A practical method of management cannot prevent a coccidial infection. Poultry should be maintained at all times on wire floors to separate birds from feces to have a fewer infections. Clinical coccidiosis is seen only rarely under such circumstances. Other methods of control are vaccination or prevention with anti-coccidial drugs as ambrolium and folic acid antagonists.